So the population of the United States was steadily increasing, and along with that was the percent of people that were considered mentally deficient. And so they estimated that roughly 5% of the population was considered feeble-minded. And this was becoming a problem for a bunch of different reasons. And so the question ended up becoming, what were they going to do about these people? Because they were almost considered to be infesting the people of the United States.
Okay, well, the hospitals, for mental patients, are just not good enough. They're the staffs are underpaid, and they just don't really know what they're doing. And there's just not enough money being spent for mental patients, and so they're just not getting enough care.
A form of treatment for sterilization or eugenics, which is a controlled breeding to desired outcome, is to sift the birth rate through and take out mental case people, and and that's through vasectomies and salpinectomies, which are operations to and so vital organs are removed, and
And no organs are removed. It's just they just they just tie things so that you can't it can't pass through. And the eugenics board will order an operation if it's in the best interest of the patient or the public, and when it's requested by a parent or a guardian, and or if the patient's children would be more likely to be mentally deficient. And if the patient's legally capable, they can give consent for their own operation, or their guardian has to. And the case can be appealed by Superior Court, but because they're so selectively picked and it's so carefully picked that it just never really happens. And they don't really do them that often. In 13 years in North Carolina, only 1,800 people had it done. And the 27 state average for the people who passed the law was just 39 for every 100,000.
In the past, we have made some modest talks at creating the imbalance in the birth rate. The use of contraceptives have been urged to help bring the birth rate into balance. The contraceptives and backfire, generally speaking. They have been assigned only among the class of persons who represent the best mental state.
Okay, and then one of the diseases is dementia praecox, and it says that it's roughly 50% of offspring will not be affected, and then it says when one parent is affected, it is likely that 1/3 of the children will inherit the defect, and then they said that it's not likely that they can wipe out the disease from simply sterilizing the hospital cases, and so and then also the feeblest of feeble-minded, it says that they don't they normally don't mature sexually, so sterilization isn't really necessarily going to help. And then also one thing is in California, one state hospital said that they save taxpayers more than $600,000 a year by an effective use of sterilization.
Because then people don't have to pay for the mentally impaired to be in hospitals.
All right, so one of the biggest arguments for selective sterilization is the quality of life that the children would have. Two mentally unstable parents usually cannot give their child a good quality of life. So even if the hereditary gene for maybe dementia or mental retardation or something like that does not get passed on, the child is still going to have an awful life, a crazy life, and won't be able to properly function and benefit society. So basically it says don't even put a child in that sort of situation because it's unfair to them and to society.
Okay, and then to prove that this has worked, in Sweden they are actually the lead in eugenics. and they have family trees going back about 250 years of most citizens for different genetic disorders and hereditary problems. So they've used that to limit things like diseases and mental retardation, things like that in Sweden. So that's proof that that works here. But here in the U.S., we don't have that kind of records of family history or anything like that. So that's why we need to do that.
All right.